Recognizing the member for Surrey South.
Thank you, Mr. Speaker. For many of us, the past 18 months have been amongst the most challenging we've ever experienced. Frontline workers are coping with burnout, children and youth struggling with isolation, seniors feeling ever so lonely, and far too many British Columbians are suffering with mental health issues in silence. However, the pandemic has also helped many more people be comfortable in opening up about their mental well-being and the emotions they may be struggling with. At one point or another, I think we can all relate to feeling isolated, anxious, and even depressed. And we must be open in naming, expressing, and discussing our emotions and our mental health challenges, even those that are uncomfortable. Next Sunday, or this coming Sunday, is World Mental Health Day. And I think it's important that we continue the momentum to break the stigma around mental health. This year's theme encourages everyone not only to reach out if they need help, but it's also calling on government and governments to make sure that help is available to everyone. I think of working moms who've been disproportionately affected by the pandemic and who are disproportionately shouldering much of the caregiving responsibilities. I think of students or people with disabilities and those in poverty because of the high costs of getting help for mental health supports. I think of rural British Columbians who have to potentially travel for many, many hours to get critical in-person care. Services need to be where people need them, when they need them, so that no one falls through the cracks. Reflecting on our current mental health system, it's abundantly clear that British Columbians need more than just supplementary programs or a reactionary system. Government needs to take proactive action to help people right now by investing in seamless mental health and addiction systems that eliminate barriers and ensure people get the help where they need it. Mental wellness starts with prevention and instilling tools at a young age for children to not only be able to better recognize emotions, but to cope with them as well. And there's never been a more important time to invest in greater mental health resources for children and youth when research has shown that they have experienced greater mental health challenges during the pandemic, including increased anxiety, post-traumatic stress, depression, and behavioral problems. British Columbia's mental health system was already stretched and disjointed, and it's continuing to struggle with the extra demand resulting from the stresses of COVID-19. Many clinics, like the Foundry clinics, which offered walk-in supports prior to the pandemic, now require appointments. These necessary pandemic safety measures are causing longer wait lists and more gaps in immediate care for youth. In May of 2020, only 3 months into the pandemic, BC's representative for children and youth confirmed there were more than 2,500 youth in BC on wait lists. The numbers only continued to grow. Any child who is at risk of self-harm or other mental health challenges can't afford to wait for months. And it's not only children who were significantly impacted, but women as well. And I've been especially concerned for women who've had to self-isolate at home in a situation that's unsafe, where they may face physical or mental abuse from a partner. Violence against women is not only a women's issue, as this House well knows. It's everyone's issue. It affects entire communities, and the trauma ripples through families, schools, and workplaces. We must, as legislators, continue to push for actions that will prevent violence against women, such as ensuring employer supports, helping those fleeing violent situations, and securing access to healthcare resources for counseling and mental health services. In 2014, I helped to table a report addressing violence against women in British Columbia. The report detailed steps that needed to be taken to prevent violence against women, and we need to continue to build on that work to ensure that the right supports are available in communities right across BC. Part of taking action is ensuring that most at-risk groups, like Indigenous women, women of color, and women with disabilities, have the right supports they need that are culturally relevant and available where they need them in an accessible way. And we all have a role to prevent violence before it starts, and responding to violence when it happens, rebuilding from its devastating effects, is the last part we play. The impacts of violence can have serious long-term consequences, including mental health struggles, isolation, social exclusion, and substance use, not just for the women or adults affected, but also for children who witness violence. This involves addressing not just the violence itself, but ensuring that those wraparound supports include counseling, housing and employment supports, income assistance, to assist in recovery from violence for the family, but also with the long-lasting effects on children. Let's work together to ensure that everyone in British Columbia that needs help with their mental health, whether it's a child facing loneliness or bullying, or a woman fleeing violence, that there's a system of care in place to help them.